Hi everybody, Ziv Simon here. I'm the creator of Surgical Master, the surgical training for dentists. Welcome to a quick lecture. And in this one, I'm going to give you a few tips on how to predict your success with root coverage procedures. So when you're seeing a patient with gingival recession, which is a very common problem among our patients, many doctors will immediately think about the type of treatment and the exact surgical procedure that they will use to treat the recession. And obviously we have many options. So don't do that. First of all, look into the different criteria that will predict your success with root coverage. And I'm going to show this in this video. And you will also be able to discuss this with your patients so they have realistic expectations. So don't jump to treat. Spend some time analyzing the recession site, looking at the different criteria that will predict success, and only then move forward with treatment and have a great surgical outcome. So when we're looking at a recession site, the first thing that I look at are the exposed root surfaces. We would like to have roots that I call receptive. These are roots that have no restorations on them, that are free of any contaminants like calculus, no caries, and nothing that could prevent the soft tissue from attaching to the root surface. The roots are ready to receive new tissue. The other thing that is very important with soft tissue grafting or any type of grafting is blood supply. Your new tissue has to be well vascularized to survive and be successful. And typically, the blood supply comes from the interproximal tissue, from the overlying flap, and the underlying bone. There's no blood supply coming from the roots, and that's important to remember. Roots are avascular by definition. So having a receptive root and blood supply are extremely crucial for the success of your graft. And together with the tissue immobility, graft immobility, meaning no movement during the healing period, these three criteria are the keys to your success. And when you fulfill these criteria, your grafts will be successful. It's also important to know and understand Miller's recession classification that divides recession lesion into 4 categories. And this classification has been around for a long, long time, but it still holds up today, even now that we have much better and improved grafting procedures. A Miller Class 1 recession is the one that does not reach the mucogingival junction. It's coronal to it, and it's very important to identify the junction when you're treating your patients. A Class 2 is a recession that extends to the junction and possibly beyond. And Class 3 is a recession that extends beyond the junction, but we're also seeing some interproximal tissue and bone loss. And a Class 4 is a recession that extends beyond the junction, a little bit more severe, with more severe interproximal tissue and bone loss, more recession on adjacent teeth, and also some possible teeth malpositioning. So what we're seeing is a recession that is increasing in severity from Class 1 to Class 4, and the high success rate in root coverage are in Class 1 and Class 2. Actually, Miller mentioned 100% success rate, which is something we never promised to the patient, but definitely higher success rates. When we treat Class 3 and Class 4 recession lesions, the success rates dramatically drop down to 50% and less, and our root coverage success is not predictable. And the question is why? Why did we get such high success with Class 1 and Class 2 and no success or very little success with Class 3 and 4? So this has to do with blood supply. The interproximal tissue is missing. It's a great source of vascularity to the new tissue, the flap, and the graft. And if the tissue is missing, blood supply is compromised, root surfaces are avascular, and all in all, your success is now diminished. So when you are considering a patient for a root coverage procedure, I would definitely encourage you to look into Miller's classification. And if you don't have interproximal tissue or it's deficient and you have recession on adjacent teeth and teeth malpositioning, you already know, and you can tell the patient that the success is not guaranteed. But on the flip side, recessions that present with good interproximal tissue, teeth are well aligned, with no recession on the adjacent teeth, the success rate will be much better, and you can move forward with confidence. Another thing that is important in predicting success with root coverage is the tissue quality. And I'd like you to see how much attached and keratinized tissue a particular recession site has. And the better the tissue quality and the more attached and keratinized tissue, the success rates will increase. The surgical procedure will be facilitated because the tissues will be more resistant when you manipulate them and handle them, and there'll be a less risk of complications like tissue tearing and perforations. And I find that my best successes are with tissues that have good quality, with a lot of attached and keratinized tissue. And of course, this is not our choice, but we have to know this ahead of time. Another important thing to know is the 3 millimeter rule, which is actually a kind of a twist on the Miller's classification, and it's more of a clinical observation. I'm not sure there's any research behind it, but I find this to work well for me. If you'd like to predict success in a particular site, what you'll do, you'll identify the most coronal part of the papilla. And then you'll count apical 3 millimeters, connect the line, and this would be the maximum level of success that you can achieve with root coverage for a particular site. So in this case, I'm quite confident that we'll be able to cover this receding root because the line that is 3 millimeter apical to the tip of the papilla is around the CEJ. So I know confidently that this will be successful. Again, it has to do with blood supply to the new tissue. So when you know the 3 millimeter rule and you take into account the tissue quality, you understand Miller's classification, and you know the keys to success and making sure that the roots that you're treating are receptive, are ready to receive a new tissue, when there's good blood supply, and all in all the tissue is immobile, you will have great success with root coverage. So understanding this is in many ways much more important than the technical aspect of how to do it. There are obviously many ways to treat gingival recession, and I'm going to go over these techniques in future videos and training programs. I hope this video was helpful to you and that I added to your knowledge and your ability to predict success with root coverage. It's a super common problem among your patients, and if you can find ways to help them with recession, you can make them very happy and they will be grateful to you. And in this process, you'll really enjoy a very exciting treatment modality. If you like this video, feel free to share it with other dentists. Go to my website, surgicalmaster.com, where you can sign up for additional videos and weekly blogs so we can learn together, get better, have fun in the process, and also have great surgical success.